Hello, Betty here. I'm doing this video from the Royal London Hospital. I'm having surgery. It will be either this morning or after lunch. And just to recap from the last video, when I explained how I had a second treatment of IPI and nivolumab, my only option to get rid of this malignant cancer, which is in my lymph nodes, and has resulted in this monster tumour on my thigh. So the drugs that were given me for that, the hydrocortisone and the hormone to replace the function of the thyroid gland, they were working out all right. But the following week I went back for the blood test. They were hoping to do the third intravenous immunotherapy treatments the following week, but then the blood showed that it had started to attack my liver, so they put me on steroids for that. And then I went back last week and my liver showed up almost back to normal, so they were going to do the treatment next week. So I come off the steroids, and then on Saturday morning, about 1 o'clock, that would have been Sunday morning, I just noticed this monster tumour is bleeding profusely, and had the bathroom towels out, got in touch with oncology at Barts. They told me to go to the local A&E, which is Whipps Cross. Michael took me in, my leg wrapped up in towels, got into casualty, mad busy, and the doctor saw me, wrapped up the wound as best they could, padded it, observed me for a couple of hours, sent me back home, and then a few hours later on Sunday afternoon it started to bleed profusely again. So I went back to Whipps Cross, and this time the doctors decided to cauterize it from the 3 different points the bleeding was coming from. And a lovely doctor there from Belfast, Emma Rose, she looked after me really well, and she decided to observe me till 2 in the morning and let me back, got an ambulance home for me. But by the following day, Monday, it started again. So Michael brought me back to Whipps Cross, and this time Emma was also on the night shift, and she said, "This is ridiculous now, we'll have to admit you. It's at dangerous levels, and there's no point in cauterizing it because it's found 3 others. It's formed a crater on the outside, and it's formed 3 other ways of flowing. The blood is flowing, even though the cauterizing points are working, but it's found 3 other exits. So all as we can do is pad it and dress it with various dressings." And she did that about 1 o'clock in the morning. 3 o'clock in the morning she had to come back and do it again. Then before she went off duty, she did it again, and a surgeon came the following day, and he said, really, that's nothing really much we can do. Barts are your oncology team. So they liaised with Barts, and Barts agreed to admit me then on Tuesday morning. And so I arrived at Barts. By this stage they were using adrenaline, soaking the bandages in adrenaline, and they were also giving me a drip with some congealer in it, which, although it was still bleeding quite a lot, it wasn't as strong a flow, so it was more manageable. And then one of the senior consultants came to see me on Tuesday, and she said could she use the photographs I'd taken of it to send to the surgeons, because she said it'll probably be better to have an intervention from one of the plastic surgeons, because they can take away the tumour. Also in the meantime she measured me up for 5 treatments of radiotherapy, she said would dry up the wound. So I was measured for that. But then in the afternoon, Dr. Cruz, another senior consultant oncologist who I've had dealings with in the past, she came to tell me the wonderful news that Mr. Stuttle had agreed to remove my monster tumour. and that was the best intervention. They wouldn't bother then, they would cancel the radiotherapy. So fast forward till this morning, and Mr. Studdle has been to see me and looked at the monster tumour. He already had my photographs, so what he proposes to do is he will not only take the tumour away, but he'll cut it right out below the muscle, just above the safe part, which is the main artery. Obviously he won't touch that. And then he's going to use either two options. He's going to either remove a large piece of skin from my left thigh that will fill up the big wound and hold its left, use that, or he might use what they call an overflap. He had his assistant surgeon with him and they discussed that, and he came in specially today to do the operation. He wants it done, but of course because he came in to do mine, he has to do lots of other procedures in the meantime, but it'll either be before lunch or after lunch. So that's where we're at. So I'm mighty relieved. And then when that's all healed up, then of course there will be some cancer cells left, but they will continue then with the ipi and nivolumab, and they won't have a bleeding tumour obstructing them. So that's where we're going forward, folks. Take care, and I'll update you if and when I've recovered. I'll update you to let you know how the surgery went. Obviously not today or tomorrow, but and of course my immediate friends and family are updated. And thank you for all your lovely comments and for keeping me upbeat. And have a wonderful day. It's difficult times with COVID. I've managed to dodge it so far. I've had 4 tests and I've been negative each time. So please God, with God's prayers and everybody's help, I will continue to dodge it, and I'll come out the other side smiling. Take care. Bye for now.